My name is Mamie Allen, and I'm an instructor here at Ultimate Medical Academy. Now, today we'll be discussing the digestive system part 2. In today's lecture, we'll discuss some diagnostic procedures as well as metabolic conditions and also the process of digestion. So, let's dive in. Let's first begin with the medical term digestion. Digestion is the process by which complex foods are broken down into nutrients in a form that the body can actually use. Here we have digestive enzymes, and our enzymes are responsible for those chemical changes that actually break the food down into simpler forms of nutrients. So what is a nutrient? Nutrients are substances that's usually from food, and they're necessary for the normal functioning of the body. Now, our normal or primary nutrients would be our carbohydrates, fats, proteins. We also have vitamins and minerals, and these are considered essential micronutrients, which means they're required, but only in very small amounts. Here we can see the process of the digestion pathway. It starts in the mouth, then trickles down to the throat, into our thoracic area, which then leads into our stomach. Now, as you can see from these arrows, from the stomach, it goes past the pancreas, but goes into our small intestine. And now, remember, the small intestine is one organ, however, it's very long, and it has the different sections. And then from the small intestine to the large intestine, and then out through the rectum and anus. One's metabolism also has a key role in the digestion process. The term metabolism will include all of the processes involved in the body's use of those nutrients that we just named. Keep in mind that there are two parts of metabolism. We have anabolism, which actually builds up the cells or those substances by using those nutrients. And then we have catabolism, and this is the breaking down of body cells or substances, releasing energy and also carbon dioxide. Catabolism is the opposite of anabolism. That should make it easier to remember the two. So if we were to break down the word metabolism, we have metabo, M-E-T-A-B-O-L, which means change, and then the suffix ism, that ISM, means condition. So metabolism is the way that our body breaks down the food and then prepares it for expulsion from the body. Now, in our previous lecture, we had the chance to look at the organs involved in this system. So here we have the mouth, which again is known as the oral cavity. We have the salivary glands, and then we also have the esophagus. So starting with mastication, this is a term that's also known as chewing. And the process of mastication breaks food down into smaller pieces, then mixes it with saliva and prepares it to be swallowed. So if you hear mastication, what should come to mind is the process of chewing. Then we have bolus, and a bolus is a mass of food that has been chewed already and is being prepared to be swallowed. The term bolus is also used in relation to the administration of medication. During swallowing, the food travels from the mouth into the pharynx and on into the esophagus. Now here in the esophagus is where the food moves downward through the action of gravity and peristalsis. Peristalsis is just simply a wave-like contraction of our smooth muscle, and it actually directs the food forward into our digestive system. So think as peristalsis as providing that motion for the food to be transported. Our stomach also plays an important role in this process. Here, our gastric juices contain hydrochloric acid as well as digestive enzymes, and these continue to break down food. Now keep in mind, few nutrients enter our bloodstream through the walls of the stomach. When that churning action starts in the stomach, this actually starts to work with our gastric juices by converting the food into chyme. Chyme is a semi-fluid mass of partially digested food that passes out of the stomach through our pyloric sphincter, and into the small intestine. Now, I think you've heard the term sphincter before, right? We covered that in a previous lecture. Sphincter, remember, is that muscle ring that allows opening and closing. Now, moving on to the small intestine. The conversion of food into usable nutrients is completed as the chyme is moved through the small intestine by what? Remember, that motion, the peristalsis, or the peristaltic action. In the duodenum, the chyme is then mixed with that pancreatic juice and bile. The bile then breaks apart large fat globules so that the enzymes in the pancreatic juices can digest those fats. This action is called emulsification, and it must be completed before the nutrients can then be absorbed into the body. The next structure below is the jejunum, and this secretes large amounts of digestive enzymes and also continues the process of digestion. And then below the jejunum, we have the ileum, and the primary function of the ileum is to absorb nutrients from that digested food. Here we're able to see the large intestine. Now, the role of the large intestine, the entire large intestine, is to receive the waste products from digestion and then store those products until they're eliminated from the body. Food waste enters the large intestine where excess water is reabsorbed into the body through the walls of the intestine. This helps maintain the body's fluid balance. The remaining waste then forms into feces. Feces are also known as solid body waste, and our feces are expelled through the rectum and anus at the end of the digestion process. So the process of passing the feces is considered or called defecation, which we also refer to as a bowel movement. You may see bowel movement depicted with the acronym or abbreviation BM. This is the evacuation or emptying of the large intestine. Now, as we have the food being broken down, we also have billions of normal bacteria present within the large intestine, and we refer to those as gut microflora. Now, the purpose of the gut microflora is to protect our bodies against infection as well as help maintain a healthy immune system. Any disruption of the microflora results in the use of antibiotics, and this can lead to infections. There are also some other terms that come to mind when you're dealing with the large intestine. Here we have flatulence, and this is also known as flatus, or the passage of gas out of the body through the rectum. We also have borborygmus, and this is the rumbling noise that's caused by the movement of gas within that intestine. Now, we've taken a look at the digestion process. Now we're moving on to some medical specialties that are related to the digestive system, as well as some specialists who may treat patients with certain diseases or disorders. So beginning with bariatrics, this is the branch of medicine that is concerned with the prevention as well as the control of obesity and other associated diseases. We also move on to a specialist called dentist, which we all are familiar with. A dentist may hold either a DDS or a DMD degree. DDS stands for Doctor of Dental Surgery, and the abbreviation DMD stands for Doctor of Medical Dentistry. Both of these are degrees. Now, the dentist will specialize in diagnosing as well as treating diseases of the teeth and the tissues of the oral cavity, or we can say the tissues of the mouth. Here we have a gastroenterologist, and this would be a physician who specializes in the diagnosing and treating diseases within the stomach and the intestines. So if we were to break this word down, gastro meaning stomach. Remember, it has the letter O on the end because it's a combining form. Then we have enter, E-N-T-E-R, meaning the small intestine. And then we end with the suffix ologist, which means specialist. Remember my previous tip. When you begin breaking down a medical term into those various word parts, start defining the suffix first, then move to the root word. Then, if there is a prefix, define the prefix last. Look below. Moving back to dentistry, we also have oral, or we can say maxillofacial surgeon. And this would be a surgeon who specializes in the surgery of the face and the jaws, and this may be performed to correct any deformities, treat certain diseases, as well as repair injuries. Sticking with the theme of the oral cavity, we also have an orthodontist. And an orthodontist is a dental specialist who prevents or corrects malocclusion of our teeth and also related facial structures. So orth, if we were to break this word down, would mean straight or normal. Odont means teeth, and then ist is just referring to the specialist. Take a look at a periodontist. This would be a dental specialist who prevents or treats disorders of the tissues surrounding the teeth. So notice when we break this term down, peri meaning surrounding, odont again means teeth, and ist is meaning specialist. So we can see this surrounds the teeth. We also have diseases of the digestive system that may be related to pathology. Whenever you hear pathology, this means disease or the study of disease. Let's break that word down. We have path meaning disease and ology or logy meaning the study of disease. Now let's take a look at the tissues of the oral cavity and some disorders that you may find there. We have first our aphthous ulcers, and this is also referred to as either canker sores or mouth ulcers. These mouth ulcers are gray-white pits with a red border in the soft tissues lining the mouth. Although the exact cause is unknown, the appearance of these very common sores can be associated with stress, also one's diet of certain foods, or a fever. When you hear the term ulcer, this is just an open lesion of the skin or the mucous membrane that results in tissue loss around the edges, which needs treatment. The next term below is chelosis, and this is also known as cheilitis. We know now that itis means inflammation. And with chelosis, this would be a disorder of the lips characterized by crack-like sores at the corners of the mouth. If we were to break this word down, we have cheil, the C-H-E-I-L, which means lips. Then we have osis, which means abnormal condition or disease. So we put those together, we have the term chelosis. Let's continue with the tissues of the oral cavity. We also have a disorder or disease called the herpes labialis, which is also known as a cold sore, or you may hear it called a fever blister. These are blister-like sores that's located on the lips as well as adjacent facial tissues, and they're caused by the oral herpes simplex virus type 1. I know that's a long name, but the acronym for it would be the HSV-1. Remember, oral herpes simplex virus type 1. Most adults have been infected by this extremely common virus, and in some cases it becomes reactivated periodically, which causes those cold sores to appear. Moving on to leukoplakia. Now here, from previous medical terminology, leuko means white in color, right? So that gives us a clue as to the definition of this word. Here, leukoplakia would be an abnormal white, usually benign sore that develops on the tongue or the inside of the cheek. If we were to break this down, again, leuko meaning white and plakia means plaque. Now, these lesions develop in response to chronic irritation within the mouth, such as if you have constant rubbing against a broken tooth, and occasionally leukoplakia patches occur in the genital area, also in the digestive system, or you may find it present in the urinary tract as well. The condition trismus describes any restriction to the opening of the mouth caused by trauma, surgery, or sometimes radiation that may be associated with the treatment of oral cancers. Here, this condition will cause difficulty when speaking, and it affects the patient's nutrition due to that impaired ability of mastication or to chew and swallow. Xerostomia is also known as dry mouth, and this is the lack of adequate saliva due to diminished secretions by our salivary glands. Let's break this down. Xero, the X-E-R with the combining form letter of O added, means dry. The stome, S-T-O-M, means the mouth or the oral cavity, And then, of course, the suffix means pertaining to, that ia or the ia. Xerostomia can be due to medications or, again, from the radiation of our salivary glands when certain disease or cancers are present, and this can cause discomfort, either when swallowing, also discomfort or changes in the taste of food, and then changes in our dental decay. Here we're identifying two conditions that you may see in infants or newborns. One is the cleft lip, and then we have the cleft palate. Now, with the cleft lip, of course, this would involve the lips, and this is also known as a hair lip. This would be a birth defect in which there's a deep groove on the lip which runs upward toward the nose, and as a result of this, the failure of the lip to close during prenatal development. Now, if we were to take a look at the cleft palate, here it's the failure of the palate to close during that early development of the fetus that is the problem. Here, this opening can involve the upper lip as well as our hard palate and or the soft palate, remember, which is at the top of the roof further back. Now, if this condition is not corrected, this opening between the nose and the mouth will make it difficult for the child to eat and speak. Cleft lip as well as cleft palates can occur singly or they can occur together and can be corrected surgically. Now let's move into some dental diseases and conditions. Starting with edentulous. This just means a person without teeth. This term describes the situation after our natural permanent teeth may have been lost. Take a look below at halitosis. This is also referred or known as bad breath. This would be an unpleasant odor coming from the mouth that can be caused by either dental diseases or sometimes respiratory or gastric disorders. If we were to break down the term halitosis, halit, the H-A-L-I-T, means breath, whereas osis, which we've seen before, means abnormal condition or disease. Then here at the bottom, we have malocclusion, which we used in the previous slide. Malocclusion would be any deviation from the normal positioning of our upper teeth against our lower teeth. Let's move on now to the next structure being the esophagus. Dysphagia is a medical disorder that you may see within the esophagus. This simply means difficulty when swallowing. If we were to break this term down, the DYS means difficult, and then the phagia, which is considered our suffix, would be the swallowing component. Take a look at the next disease or disorder. This would be eosinophilic esophagitis. What do we see? This would be a chronic immune system disease in which a type of white blood cell, or we can call those our leukocytes, we call those eosinophils. And these eosinophils begin to build up within the esophagus. Usually this will occur as a result of an allergy to certain foods. So as always, let's break down this term. We have the esophag, E-S-O-P-H-A-G, and of course that's easier to remember because it's relating to the esophagus. And then we have the itis, meaning inflammation. So if we were to put those terms together, we have esophagitis. And esophagitis results from inflammation that can make it difficult to swallow. This disease will appear to be more common in children and adults. Here's a condition of the esophagus you may have heard of before. We have the gastroesophageal reflux disease, and this is also known as GERD. You may see that abbreviation. Here, this is the upward flow of acid from our stomach into the esophagus. Gastro meaning stomach, esophag meaning esophagus, and then we have the EAL, which is the suffix that simply means pertaining to. When you hear the term reflux, reflux just means a backward or a return flow, a backflow. When this occurs, or when reflux occurs, the stomach acid begins to be irritated and then damages our delicate lining of that esophagus. Take a look here at the Barrett's esophagus. This is a condition that occurs when our cells in the epithelial tissue of the esophagus are damaged by chronic acid exposure. And remember, chronic means over a long period of time, whereas acute means sudden onset. Now, some patients with chronic GERD develop this complication, which slightly increases their risk of esophageal cancer. Now, let's take a look at the stomach and some conditions or diseases relating to the stomach. We have gastritis, which is easy to define. Gastrosteitis. Gastro is stomach, itis is inflammation. So this is a common inflammation of the stomach lining that's often caused by a bacterium. We then have gastroparesis, and this would be a condition in which our muscles in the stomach slow down and they begin to work poorly or sometimes not at all. This prevents the stomach from emptying normally. Let's break this word down also. We have gastro, meaning stomach, with paresis, meaning partial paralysis. Remember, paralysis means immovable. And then the last condition on this slide, gastrorrhea. Now, rhea is the suffix meaning a flow or a discharge. And again, gastro stays the same, which is stomach. Now, gastrorrhea is the excessive secretion of gastric juices or the mucus in the stomach. Peptic ulcers. Now, we've defined what an ulcer is, but we've added more detail by the term peptic. Pept means digestion, and ic is just that suffix meaning pertaining to. So peptic ulcers would be sores that affect our mucous membranes of the digestive system. Now, peptic ulcers are caused also by a bacterium, or they may be caused by certain medications, such as aspirin. And these medications may irritate that mucous membrane. When a patient is actually diagnosed with having peptic ulcers, this may be referred to as the patient having peptic ulcer disease. So let's take a look at some types of ulcers. We have gastric ulcers, and these are just peptic ulcers that would occur within our stomach. We also have the duodenal ulcers. By now you may see that it's based off of location, so we know that this is involved in the duodenum, which is in the small intestine. So a duodenal ulcer would be peptic ulcers that occur in the upper part of the small intestine because that's where that duodenum structure is located. Then we have a perforating ulcer, and this is a complication of the peptic ulcer in which the ulcer begins to erode through the entire thickness of the organ's wall. We now move on to some nutritional disorders of the digestive system, starting with anorexia. This would be the loss of appetite for food, especially when caused by a certain disease. Now, anorexia nervosa, as well as other eating disorders, may be discussed in other chapters. Next, we have cachexia, and this is a condition of physical wasting away, which would be due to the loss of our weight and that muscle mass that occurs with diseases such as advanced stages of cancer or AIDS. Although these patients might be eating enough food, their bodies are unable to absorb enough nutrients to assist in this process. And then, as we're speaking of lacking, dehydration comes to mind. This would be a condition in which fluid is lost, meaning no excess fluid intake, and this would disrupt our body's normal electrolyte balance. So if we were to break down the medical term dehydration, the D, the DE means removal or removal of. Then we have hydra, meaning water, and then we have the suffix of tion, shun, meaning the process of. We also have the term malnutrition, and mal means bad or poor. So this means a lack of proper food or nutrients in the body. This may be due to a shortage of food. It could be due to one's poor eating habits or just the inability of the body to digest, absorb, and then distribute those nutrients. And then taking a look at malabsorption. Again, the mal is meaning poor. So malabsorption is a condition in which our small intestine can't absorb enough nutrients from the food that passes through. Now, previously, we've discussed other disorders such as anorexia, and that would be the lacking of food. However, now we're moving into obesity, which has to do with the excessive accumulation of fat in the body. When you hear the term obese, this is usually used to refer to those who may be either 20 to 30% over the established weight standards depending on their height, age, and gender. Remember, whenever you hear the term gender, this is just referring to the differences between male and female. Now, when obesity becomes excessive, we refer to that as morbid obesity, or you may hear it called severe obesity. And this is a condition of weighing 2 times or more than the ideal weight, or you may have a body mass index, that BMI, with a value greater than 40. Whenever you hear the term morbid, this just means a diseased state of being. Now, I briefly touched on the BMI. You may see it depicted with the acronym BMI, and this stands for Body Mass Index. Now, your BMI is a number that shows your body weight adjusted for your height. The results begin to fall into one of these categories: the categories of underweight, normal, overweight, or obese. So a person with a high BMI has many factors that may relate to developing chronic diseases later in life, such as heart disease, cancer, or even possibly diabetes. Moving on to intestinal disorders, food allergies, lactose intolerance, as well as colorectal carcinoma are just to name a few. Now, starting with our food allergies, this is when the immune system reacts. And this occurs after eating a certain food. It has a negative reaction. Also, lactose intolerance. This is the inability to digest dairy products due to the absence of the enzyme lactase. Enzyme lactase is needed to process the sugars that may be found in some dairy products, such as milk. Lactose intolerance may be common in African Americans and also East Asians. Below, we also have colorectal carcinoma, and this is commonly referred to as colon cancer. And with colon cancer, it often manifests itself into polyps into the colon. Now, polyps would just be abnormal tissue growth. So when thinking of that abnormal tissue growth, a polyp would be a mushroom-like growth from the surface of a mucous membrane. Keep in mind, though, not all polyps are malignant. You may have some that are benign. When polyps are benign, it means that they simply exert pressure on different structures that may be in close proximity, but it may be a bit uncomfortable, but the good thing is it's not fatal or life-threatening. Here we have the intestinal disorder, diverticulitis, and this sometimes develops as a result of diverticulosis, which is the inflammation or infection of one or more of parts of the colon. Now, symptoms of this condition may include acute abdominal pain as well as cramping and nausea. Let's break this word down. We have diverticulitis. So the dive, the D-I-V-E-R-T-I-C-U-L means diverticulum. Then we have itis, meaning inflammation. So what you can see here would be another disorder, and we call this the volvulus, and this would be the twisting of the bowel within or on itself. As we can see the twisting motion there, it gives you a 180-degree twist within the intestine. Now, this twisting is caused by an obstruction. From this condition too, you may also see necrosis and also affected segments of the bowel, just meaning different sections of the bowel area. As we wrap up today's lecture, we'll end discussing diagnostic procedures of the digestive system. And there are 2 that we'll discuss today. You may see a CT, and the CT stands for computed tomography. But when we add the abdominal before it, makes it abdominal computed tomography, and this would just specify the abdomen area. Now, a CT is a radiographic procedure that produces a detailed cross-section of the tissue that's located within the abdomen. You may see the presence of a tumor or obstruction present. We also have the abdominal ultrasound, and this is a non-invasive test which is used to visualize or look at our internal organs using very high-frequency sound waves. We also have an enema, which I'm sure many of you have heard of, And an enema is the placement of a solution into the rectum and colon, and the purpose of that solution is to empty our lower intestine through bowel movements or through bowel activity. Now, an enema is sometimes part of the preparation for certain examinations, which would be endoscopic examinations. However, these enemas are also used to treat severe constipation and as a means of injecting medication into the body. We also have a diagnostic test called the cholangiography. And a cholangiography is a radiographic examination of the bile ducts with the use of a contrast medium. Now, contrast medium just simply means a dye that's inserted into the structure to make certain components more identifiable. Now, the cholangiography is a test used to identify the obstruction in our liver or our bile ducts that may slow or block the flow of the bile from the liver. Now, you may also hear this term, esophagogastroduodenoscopy. Let's say that again, esophagogastroduodenoscopy. This is a long word, but as we see, it's easier to define when we start to break down those word parts. So are you ready? Let's give it a try. Esophago is referring to the esophagus. Moving on to the next word part, gastro, meaning the stomach. Then we have duodeno, referring to the small intestine, that duodenum. And then scopy is referring to a visual examination. Now, when someone has this procedure, this would include the esophagus, their stomach, as well as the upper part of the duodenum. And then last but not least, don't forget about stool samples. Stool samples are effective in diagnosing digestive disorders. Stool samples would be specimens of feces that are examined for the content and characteristics. For example, a patient with fatty stools may indicate the presence of pancreatic disease. And to determine if disease is present, cultures of the stool sample can be examined in a lab to just check for the presence of any bacteria, or O&P. O&P is just an abbreviation that stands for ova and parasites, or you may say parasite eggs and parasites. Now, as you begin to dissect these medical terms, keep in mind that diagnostic procedures will help a physician determine what treatment plan is suitable for that patient. So, have fun this week, and I wish you all the best of luck. Thanks so much for joining me today. Have an awesome week.